Amlo, 80 years old, former Kenyan Prime Minister, was brought to our emergency medicine today morning at 8:20 a.m. with a history of sudden collapse during his morning walk at Sritariyam, which is an Ayurvedic hospital close to our place. Then itself, they had started CPR, that is cardiorespiratory resuscitation, and he was brought with a CPR, active CPR. His doctor and security were with him, and we continued CPR and did emergency intubation, that is putting a tube in the respiratory system, trachea, and continued CPR along with other resuscitative measures. Initially, there was no pulse or BP recordable, even palpation-wise. So after doing intubation with continued CPR, we shifted the patient to our ICU with all the staff and the facilities. In ICU, after some time, we could get some rhythm. On the monitor, it showed ST elevation in the ECG leads, in the anterior leads, plus we could see regional wall motion abnormalities, that is reduced movement of one artery territory, that is LAD territory. There was hypokinesia. This means there is less movement in that area. So after stabilizing him with some IV fluid and all, we just give him an injection, that is injection reticulase, for dissolving the clot if it is there in the coronary arteries. And we could see him with the significant edema of the right lower limb, right leg. When whatever information we got from the doctor was, he was a diabetic, hypertensive, chronic kidney disease patient. He had right lower limb DVT, for which he was put on IVC filter. And recently he had a thin subdural hematoma. Last Saturday when it was done, that was almost very thin. And the neurosurgeon was the doctor who was with us in the ICU, one who followed the patient from, accompanied the patient from Sritariyam. So after discussing with him, we went ahead with the thrombolysis with the injection reticulase. Even we continued CPR, that is from 8 o'clock in Sritariyam till 9:52 in our ICU. With all other ACLS criteria, we continued CPR. In spite of our very sincere, very continued CPR and other measures, we couldn't make him survive. So we are very sorry to inform that he is no more with us, and our very sincere condolence and prayers for his family and for the Kenyan people.